Welcome to our presentation about innovative partnerships for an impactful and sustainable dog and cat population management. My name is Manuela Rowlings. I'm the head of Stray Animal Care Europe and the head of community engagement at PAWS. And I will guide you through the next 20 minutes where we are presenting 3 examples detailing collaborations between essential actors in this management system. When wanting to reduce the overpopulation of our companion animals, and next slide, please, to reduce the overpopulation of our companion animals, so mostly dogs and cats, which results in huge welfare issues for animals suffering in the streets and in shelters, we are often stunned by the sheer scope and size of the problem. At the moment, there's an estimated 100 million dogs in Europe alone and more than 130 million cats. So to keep such populations in good health, one essential component is veterinary care, which is typically provided by private practices and are thus subject to market demand. On the other hand, as animal welfare organization, we recognize that high volume and high quality veterinary care is also an essential component to keep populations stable and, most importantly, to reduce the number of unwanted animals. We are thus in this presentation focusing on partnerships that go beyond the private demand for veterinary care with the aim to benefit several stakeholders. From our perspective, most importantly, of course, the dogs and cats, but also the communities where these animals live in. And with that, I would like to hand over to my colleague Alesya from Ukraine, who will start with the first 2 examples.
Thank you, Manuela. Good day. Like Manuela mentioned, I'm Ukrainian, and today I would like to take this opportunity and to talk to you about my country. In times of war, where the stakes are the highest and the challenges are most troubling, the innovative partnerships offer a ray of hope, enabling us to build a more stable and sustainable presence in the country while providing so much needed help to the companion animals. The success of partnerships, especially in the context of addressing challenges like crisis or war, requires careful planning, clear communication, mutual trust, and shared commitment to the common goals. To illustrate the key elements to foster good and long-term partnership, I would like to use an example of a successful Ukrainian project called Kishka. Kishka means a female cat in Ukrainian. So let me explain beneficial structure of the project. We have put together this visual to illustrate the main obligations and duties of the partners. The stakeholders are the following. So PAWS is an international NGO that coordinates and oversees the whole project, as well as makes sure that the vets work in accordance to quality standards. It covers the costs of medicine, equipment, etc. Communal enterprises. These are the companies working on dog population management or cat population management in the public sector and funded usually by the city budget. The communal enterprises provide their own infrastructure for the treatments. In our case, it is pro bono, as well as they promote the project locally. So local volunteers and caretakers can bring stray cats to the clinic. And the most work is, of course, on the PAWS vets' shoulders that provide high volume and high quality sterilization and vaccination of cats against rabies, plus other required treatments. Here we can find some outcomes of the project. So far, the big idea is to increase the number of sterilized and vaccinated cats in 5 cities in Ukraine. And you can see the stars on the map. There are cities of Sumy, Chernihiv, Umань, Mykolaiv, and Poltava. An essential component of this project is the collaboration between local vets and also international vets. All our Kishka vets had an opportunity to share veterinary experience with our Bulgarian colleagues. Vets had a chance to participate in the Ukrainian scientific project in partnership with the vet faculty of Kyiv region, and the project is still ongoing. Some of the colleagues had a chance to present the intermediate results of Kishka project at Sava conference in Portugal. And it's amazing that since end of 2022, in total, PAWS vets have treated more than 12,000 cats in Ukraine, and we are immensely proud to announce this. So I would like now to present you the key elements that we believe are needed for the success of the project. First, we started partnership with several Ukrainian communal enterprises with a shared understanding of the goals and objectives. We agreed that up to 10,000 sterilized and vaccinated against rabies cats in Ukraine would be our goal. Then, as we know, each partner brings unique strengths, resources, and expertise to the table. PAWS came with the professional expertise and training, and the partners commit to the success by providing premises and ensuring the promotion of the project globally and locally. Third, that transparent communication is essential in building trust and understanding among partners. So we try to conduct regular meetings, have honest dialogue, share news and information. And from the very beginning, we clarified the roles and the responsibilities in the agreement to ensure that each partner understands their contribution and can work effectively according to their obligations. And additionally, we as partners should be very adaptable, especially to the changing circumstances. We must find common ground and understanding in times of crisis. Last but not least, establishing mechanism for monitoring progress is crucial for accountability and learning. So what we agree is by prioritizing these elements and fostering a culture of collaboration, trust, and mutual respect, partnerships can become powerful vehicles for driving positive change and addressing complex challenges such as war and conflict. And I would also like to move to the next bright example of the partnership that has big potential in the future. PAWS is excited to announce a groundbreaking partnership aimed at addressing the urgent need for the accessible veterinary care through the establishment of unique social veterinary clinics. And once more, I would like to dive into the structure of the project. So our partners, these are USAVA. USAVA stands for Ukrainian Small Animals Veterinary Association. USAVA has the role of coordination and controlling of the ongoing project in the field. PAWS International covers the financial support of the project and the veterinary clinics. So these are the third stakeholders. We plan to cooperate with existing local clinics that have the capacity to grow and dedicate time to the activities of the project. So this initiative is designed to provide essential veterinary services, including sterilization, vaccination against rabies, microchipping, registration in all Ukrainian database, and a number of treatments for free. This pilot project serves as a model that can be later replicated in other regions where the demand for the veterinary services is high, but the local capacity is really limited. By demonstrating the impact of this initiative, we aim to secure additional funding and support to expand our operations to the underserved areas. An essential component of our project is a collaboration with local veterinaries and veterinary students. There is opportunity for local vets to learn from the experienced team. Veterinary students can join as vet techs, gaining hands-on experience while assisting in preparing animals for operations. We engage with the community through various channels to promote our initiative, to inform the public about the importance of animal welfare and responsible pet ownership. So far, PAWS and USAVA came to agreement for 2 social clinics in Zaporizhia and Kyiv regions. This innovative partnership represents a significant step forward in providing essential veterinary care in these regions. We believe that by addressing the immediate needs of stray and owned animals, we improve public health, animal welfare, and community well-being. We are committed to the success of this pilot project and look forward to expanding our reach to other regions, making a lasting impact on the lives of animals and people alike.
I hope you enjoyed the examples from Ukraine so far, and I would now like to hand over to Helen, who has another fabulous example of an innovative partnership delivered by StrayCoCo in Kosovo.
Thank you, Manuela, and for PAWS for this occasion to speak about our program, which started in January 2015, when I found the only veterinarians for pets in the countryside in Jakova, the couple Beidoni, which both have graduated in Tirana University and had no jobs at that time because no one could afford to pay veterinary treatment for his pet. You see here Blendi Beidoni. So let's go back to the general situation 2015, slide 2. Complete lack of knowledge about CNVR in this country and how to deal with stray dogs. No vets for pets in the countryside, very few in the capital city, Pristina. Pet clinics in the cities were and still are usually little rooms and food selling shops. Estimated 140,000 stray dogs in whole Kosovo, sick and hungry, not counting the puppies, and a few privately requested castrations were done in the fields with a water canister or tried by small NGOs, which gave up fast. So we started immediately to work in the western city Peja, as reports from the Peace Corps were so awful, dogs killed by the local vet and dumped in a hole. The Italian KFOR, Kosovo forces, which have their camp in Peja, supported us. From the beginning, we informed the mayor as we needed his permission to work on the city waste dump. The Italian KFOR supplied us with 3 containers, 1 for surgery, 1 for recovery, and 1 from the night guard. So the mayor brought us an air conditioner, slide 3. So until the end, no, go back please. And until the end of March 2016, our vet couple treated 1,440 stray dogs in Peja. We kept the veterinary administration informed and politicians noticed what we did. So CNVR tenders were given in 2019-20 by the state of Kosovo for the very first time. It was horrible because vets joined the program without any know-how about pets. They were they were friends of friends in the veterinary administration. Corruption was high and dogs died after treatment in the streets. In a second program, the state managed to do better. And now from time to time, municipalities start their own tenders. In the end, our model, it was thought as a model, was successful and raised awareness that pets in general deserve treatment. You all might know the proverb, give a man a fish and you feed him for a day, teach a man to fish and you feed him for a lifetime. 2018, we started to invest in modern pet clinics and sanctuaries with our partner veterinarians and were criticized a lot for investing in infrastructure, instead giving all we had directly to every dog that was found. But we stick to our 3-party program to create lasting help for the pets. A lasting program means that the pet treatment should get common good and go on once we leave this country. To create a lasting program means to cooperate with private and public sector. We also believe that the economical principle Angebot erzeugt Nachfrage, supply creates demand, is working for pet treatments. The opening of the ProVet clinic in Jakova, which you see here, led to much attention, was visited by politicians and the veterinary administration. We built 2 more clinics with new reliable vet partners in Vustri and Renas. Actually, we continue with the clinic on the hill between Mitrovica and Skenderaj. In all those regions, we do continually since years CNVR programs supported by the municipalities, but in a limited amount due to our finances. The more citizens saw that there are clinics for pets, the more came for private treatment. All clinics are, by the way, startups. That means they belong finally to our partner vets, which took mortgages to pay their part. This model comes out of humanitarian aid and development cooperation programs many states and NGOs have working in poor developing countries. Kosovo is the poorest on the European continent. It gives animals, thanks to the raised awareness, a better health, and veterinarians, as well as their vet techs and workers, finally a higher living standard. For us, this is a lasting investment. Next slide, please. We are regionally organized and started with our new partner veterinarians just to neuter and release street dogs. And after our work was noticed, we negotiated contracts with the municipality, which in the meantime were repeatedly signed. The main goal of the contracts is that our treated dogs are accepted in the streets, the model of community dogs favored, that the municipalities help to raise awareness, so abandoning should stop, And the municipalities all share the costs of neutering, vaccinating against rabies, and deworming with us. Thanks to the local political support, we have as well a cooperation with the local police and the schools. Furthermore, in the first 3 years, we offered several postgraduate seminars for the Kosovo veterinarians, as all of them in the countryside were at that time specialized for farm animals. We then gave a kickstart to a new NGO, KSAVA, Kosovo Small Animal Veterinary Association. So now the veterinarians that want to treat pets can follow the postgraduate program of KSAVA, a new member of ESAVA. Before only the General Veterinary Association existed, members are mostly vets for farm animals, and this association never before offered postgraduate education for vets for pets. Next slide, please. Since beginning of the regional CNVR program, our partner veterinarians visited schools, invited school classes in the clinics, and educate kids how to keep pets at home, how to behave around stray dogs, the reason why there are stray dogs, and that abandoning is cruel. Awareness programs you find on our YouTube channel and our website. Next slide, please. Remember that we are a very small foundation with little support by others and little financial means. Still, we managed to treat at least 12,000 stray dogs in 4 regions of Kosovo. I thank you for your attention. Thank you for PAWS.
Thank you, Helen. Thank you, Alesya. We very much hope that we inspired some of you with these examples, really best practice examples of how to build local veterinary capacity, which is essential to eventually reduce the numbers of unwanted dogs and cats in the streets and in shelters. Thank you so much.